Hi, welcome to the advanced program. This is week 1, session 1, and I am joined today by my husband, Tom. Tom works in an office and he's had bad back for many years, but having done Pilates, it's helped him tremendously. He's also a keen golfer and plays squash, and so that helps him massively with his mobility and his strength and his performance in those sports. So today, what we're going to do is work on mobility, particularly in hips, which is excellent for those who play sport and those who find sitting at a desk creates bad back. So all of this is all about opening up your hips, stretching your hip flexors in particular and your quadriceps. So what you will need is a block potentially to sit on, or a chair if you have one to hand. I have 2 cushions, head cushions, so that you can kneel on, but again, you can use some towels. And sometimes I find people get cramp when they're kneeling underneath their ankles, so a little rolled up towel is also useful. So what we're going to do is I'm going to get Tom to come up into kneeling, facing in that direction, and you do so as well. So we're going to pad your knees out if needed. And then you're going to come into kneeling on there. And we're going to do an exercise called sit back and curl. So coming into kneeling. Good. And this is high kneeling. So Tom's going to have his knees underneath his hips. And his pelvis is in a centered position with his spine elongating on top. So your centered position is your neutral position where your pubic bones and hip bones are aligned, and then your spine is snaking and lifting up. So sense the space in the vertebrae of your spine. So bone by bone of the spine stacks up and you lengthen upwards from there. Now what we're going to do is to do the sit back and curl, test to see what the hip flexors and quadriceps are feeling like, and then we will move on from there to some exercises that will help tremendously. So Tom's going to place his hands onto his pubic bone, so that bony protrusion at the tip of the pelvis, and then heels of his hands onto his hip bones. From here, he's going to engage through his core muscles. So that is your pelvic floor, your back passage to front passage, connecting gently. Remember, this is not 100% grip for dear life down there. It's a gentle stopping yourself from, for example, farting, and a gentle drawing up through the front passage to stop yourself from going for a wee. But it's just a sensation. So just bear that in mind. Then from the front, it's your lower abdominals feel like they're tightening to the midline. So it feels like a drawing together of your hip bones, or a pretend lift doors are closing gently. From here, he's going to tip his pelvis back as his head goes forwards, and it's almost like a seated squat to go back. He hinges back. He's going to pause there. Now he's going to curl his pubic bone towards his chest. So as he curls his pubic bone towards his chest, he's going to really activate his abs. As he activates his abs, the front of his thighs will get even more of a stretch, and I'm sure he's feeling that right now as I keep him in that static position. And then he's going to shift forwards, try to bring his pelvis and his spine over his knees. Good. And again, so you're going to shift back. Send your bottom back, let your head go forwards. Good. Finding that hinge from the hips. Then from there, it's that curl, bringing the pubic bone up towards the ceiling. Abs are working hard for you, and then the spine comes back up as the pelvis over the knees. Keep going for 3 more. So shifting back, you can see this lovely long plane of his spine. Then he's tipping even further, so he's finding more room in his hips to get that initiation of the tucking. And that is really important. You tuck and tuck and tuck and tuck. Good. Last one. Good. Keeping that abdominal connection, particularly on the way up. It's that sense of pubic bone up. Curl, eyes to your pelvis as well as you come up. Well done. So that is just a sensing to see how your hip flexors are behaving. So some of you might not be able to go as far back as Tom, but that's okay. Just do it a bit less. So now what we're going to do is face forward and go into a hip release motion. Staying in kneeling, we're going to start with the right knee down onto the cushion and the left foot forwards in a 90-90 kneeling position. Good. From here, Tom can place his hands on your left knee, so you can do the same. take your foot forwards a little bit more. So you want to have your foot directly underneath your knee. On the other side, you've got your right knee underneath your hip. Now, what we're going to do, from the pelvis, I want you to think about your pubic bone gently lifting upwards, avoiding the chest bending backwards. So you're essentially bringing your pubic bone to your chest and you've got that strong connection of your core. Good. From here, what Tom's going to start doing is to take his spine with him and go forwards in a motion. He's avoiding any hinging in his back, and that's what the pubic bone is going to lift. So let your chest and spine go forwards with you. Excellent. Now from here, I'm slowing this motion down so you can really see what's happening in his ankle. I'm allowing his knee to travel over his toes. Absolutely fine, because I want to challenge his ankle mobility. So if you're thinking about a lunge in squash, for instance, brilliant. So you're already challenging your mobility of your ankle. Now we're going to add on. Tom's going to come back and just go forwards. So I don't want it to necessarily be so slow, but whilst you're learning, it can be. Now what I'm doing here, I'm holding onto his abs and giving him a sense of not letting the belly drop and come back. So he's going to do one more like this. So you're going to go forwards and spring back. Excellent. Now we add on. Tom's going to turn, and you do so as well. You're going to externally rotate your foot. Your knee travels with it. Good. You're then going to go into the hip release and then spring back up. And this is the zigzag motion. This is a really good opener for the adductors, the inner thighs, which act as hip flexors. So off you go, Tom. So you're going to do 3 like this and come back. Good. Abs are connected. Pubic bone lifts up towards your chest. Good. The reason being, again, you don't want your back hinging. And what I'm going to do is to get Tom in a second to do one where his back is released. So go into one and let your back bend backwards. So let your chest lift up. This is not nice at all. He's really gripping in his lumbar spine, and then he's hanging off the ligaments in his right hip flexors. I don't want you to do that. I want you to stay, and you can see he's more unstable. I want you to keep the stability of your trunk as you go into this. Let's do one more again. Brilliant, Tom, and then come back. Now, he's going to turn his leg inwards now, but still walk out. So from his toes, his heel goes out and zigzags out to the left. He's going to do 3 of these. Good. So this is multi-dimensional movement of the hip joint. Excellent for mobility. Good. After he does 3 of those, he's going to turn the leg out again and do 3. So every time his leg will start walking out towards the left, increasing the range of movement in his hips. Good. See how you go with this. Take it slowly, take it easy. It might be the first time you've worked your hips in this more multi-dimensional way, and then you end up at a point where you think that is enough. Yeah, you can't go any further, your hips can't open any further, and I want you to pause there. So Tom, do you think you're about there?
Yep.
Good. So from here, I want Tom now, and I want you to turn your foot so that it's parallel to the knee. So bring your foot, your heel back in line. Now, and then your knee, heel underneath the knee. Good. So now Tom is at his maximum openness of his hips. We're going to challenge this into more bouncing motions. So the spine is going to be arranged. In terms of your chest, it's facing forwards. But your hips your pelvis will be slightly rotated towards that side. Let it be. So you're in a little bit of a rotation of the spine. That's okay. Find your happy position where you feel balanced. Good. Abs are connected. So core is connected, watching that you're not back bending. You're thinking about your back of your head being in line with the back of the shoulders, being in line with the back of your sacrum. Good. So Tom now is going to go into more hip release. So let's shift into your left hip. Eyes are facing forward, so that means your chest stays with you. Good, and then you spring back up. Your other hand could go on your front of your pelvis just to give you some feedback. So off you go. We're going to go into it and spring up. Into it and spring up. Good. So the spine is staying beautifully aligned. It's keeping that poise and keep going. So you can start quickening the pace. You're going into it and coming out and going into it and coming out. Excellent. What you want to avoid is your spine is start doing this whipping formation. You don't want your head and your spine to whip, but if you can keep your nose, your sternum and your pubic bone all aligned as you go into it. Keep going as best as you can. Well done. Have a breather. I'm now going to get Tom to bring his knee underneath him again, and if you need your cushion, please use it. We're going to internally rotate those legs because we've just had them in a really big open position. So can you rotate your thighs towards the center, the midline of your body, as the feet go out? Well done. Now Tom's going to do a sit back and curl in this position. It's going to feel quite congested in your hips and slightly strange because we don't have that much internal rotation of our thigh bones, of our hips, but it's highly important for the function of your body to be able to do this. So we're going to sit back. So hands can be on your pelvis to give you some feedback at the front. Good. And then Tom's going to tip his pelvis back as his head goes forwards. Good. And keep tipping back as far as you can. Pause there. Then he's going to curl. He's going to curl his pubic bone upwards towards his chest as he comes back up. Excellent. And he's going to tip back again. We're going to do 2 more. And curl. Good. And tip back. And curl. Nice. Really good work. So we're going to do the other side now. So leaving your left thigh down, take your right forward. And now you know what I'm looking for, and you can become a little bit more conscious of your own body and your alignment. We can start quickening the pace. So you have your hands onto your knees, the pelvis is in a centered position, the spine is elongating on top, thinking about the back of your head being in line with the back of your shoulders being in line with the back of your sacrum. Good. We're going to start going into that bounce. So find that poise. You're going to go forwards and come back, so that the body is being led with it. It's not about your abs pushing forwards and your back bending backwards, but it's very much find that zip of connection from the pubic bone to your chest and let your head go with you and come back. Go forwards and come back. Good. Good. Well done. Now let's start walking the leg out to the right. So turning the leg out, we're going to go for a triple bounce. Slowly controlled movement. Good. Turn the leg in. So you pivot on the toes, let the heel go out, and then it's into it. And this is tough, you know. Tom's making this look quite fluid, but it is tough. So make your zigzags smaller if you wish. Good. Turning it out as best as you can, and just watching that your body doesn't do that whipping action. Can you keep the poise in your spine as that happens? Good. And then find your maximum opening of the hip, where you feel that your spine isn't being crunched, as in into that hyperextension in your lumbar spine. Good. So let's find the knee over the foot. The chest is going to face forwards, so facing that direction, but the pelvis is facing towards that side. So from here, your left hand can go onto your front of your hip. It just gives you some feedback. And then you can also think about the pubic bone pulling upwards towards your chest. That really activates those lower abs, keeps your lumbar spine nice and stable. Into it. So Tom's going to go into it and spring back up. And go into it and spring back up. And keep going like this. Good. Really good. So if you're somebody who is quite mobile and you can get quite far down, all the way down like this, I don't want you to be there. Stay upwards. Push into your foot a little bit to help you spring back up. If you're somebody who is stronger composition, you find mobility, which is the majority of men, find this kind of mobility, flexibility difficult, try to see if you can go into it a little bit more. You're avoiding compression. Good. Tom's going to do just a couple more because I want to point out just lastly, I want you to keep that heel down as you go into it, and then as you come up, keep the toes down. Well done. So from there, Tom's going to come into his kneeling, and I'm actually going to get him to face this direction. So this is where we started. Back onto the knees, both knees. He's going to do 3 with the internal rotation just to soften the structures that he has just worked. So come into kneeling. The knees come together towards each other and the feet go apart. And then from here, hands onto his pelvis. He's going to shift his bottom back. So his bottom goes back, your head will then go forwards. Good. Then you're going to curl the pubic bone in towards you as you come forwards. Abs are strong, watching the chest doesn't pop. Go into it. You can do halfway. You don't have to do all the way down, and curl. Good. Last one, as he goes into it. This is the curl. When he tips his pubic bone, this section gets that huge amount of stretch. Well done, Tom. Bring your feet and knees back into parallel. Good. Here, if you do struggle and you're like, I am cramping loads, this is where the towel can come into it. You can pop the towel underneath your ankles just to give you a little bit of support. So Tom's going to sit back now where we started and just do a curl with knees parallel. I am hoping that he feels a lot better in his hips because of this. So we're going to sit back and curl and come out of it. Good, well done. Pause there. From here, we're going to come into sitting on a block. So coming off your knees. And we're going to do a little bit more of a hip opener. So Tom's going to come and sit on a block with his left knee there, forward, and his right leg back. If you can sit on the floor like this, by all means do so. If you struggle, so come into the center of the mat and do that. If you struggle, do what Tom's doing, popping yourself forwards, sitting down on your bottom on that. Well done. Right knee is tucked behind you. This is called a Z-sit position. Left knee is reaching forward. So what you're going to try to do is square your pelvis facing the forwards as much as possible. You can take your right knee a little bit more forwards. So if you use your mat, if you're unsure of this, I like using my mat. I can see that Tom's rotating towards the right. So imagine your hips like headlights. So if you've watched previous videos, you will know I describe, think headlights. The headlights of the hips are facing forward. Think about looking down, are the headlights facing towards your right? Try to think about bringing your headlights of your hips facing forwards, and then the spine can then zoom up. So from here now, we're going to go into some more dynamic motions for hips. Engage through your core. Curl your pubic bone towards your chest. You're going to rotate your hips. So let the headlights rotate towards your left. And what that would do is to really open up and stretch the front of your thigh. Tom's going to press down a little bit through his left hand and lift himself upwards. It's like a spiraling motion up towards the ceiling. Good. And then he's going to unravel from that and come back down. And again, curling, pubic bone curls upwards. So really see in the pelvis now that you're tucking and curling. So you're going to tuck and curl, pubic bone lifts. Can you see how that hip goes there? I'm increasing that stretch of his hip, and see if you can do so. Come back. We're going to do one more, and then roll the pelvis towards the opposite side. Well done. Excellent. And come back down. Take your bottom off the block. And what Tom's going to do now is come lying down onto his left shoulder, a bit like a side lying plank. He's going to stretch out this hip. which feels nice. And then he's going to really pivot himself onto his bottom to bring himself upwards like that. So come sitting on your bum and then take upright, and then take your right leg up. Sitting up, there we go. And then take your right leg up. What I'm getting him to do now is to bring some strength back into the hip flexor he has just stretched. Brilliant. We swap over. So bring the right down now, take your left back. And then I've got the block for him. So come to the center of the mat, and then you can do that a little bit better. Good. Very nice. And again, we'll do the same again. So set your structure up. Where are your flashlights? Where are the headlamps pointing? Are they pointing to the left, or are they pointing roughly as best as you can forwards? So if a block is not enough, remember you can just grab a chair to sit on. So from here, tummy muscles engaged, core engaged. We're going to rotate the pelvis to your right now. As you rotate, you're sensing that lift of the pubic bone coming up to the chest. And then you release from that and down you come. Good. Curling that hip over. And then you're lifting upwards, upwards, upwards. Chin's tucked in a little bit more. Good. Lift yourself in the opposition of that hip and come back, soften. And we go into it. You can inhale now if you want to add some breath. Exhale, soften. Good. Inhale into that rotation. Good. And you can really tell now which hip feels more tighter, congested than the other. And that's what you can do. You can start working on the side that feels a little bit more congested. Good. Let's do 2 more. And you can start bringing yourself into bigger movements of that pelvis. Really good. And then last one, and then we can have a breather. Finally. Excellent. Tom's now going to come off the block. You can come off your block or your chair, whichever you've got at home. Come down onto your elbow, onto your right side. Stretch your left leg out. Yep, so come down onto that elbow and stretch your left leg out. That's it. And then that means you get that sense of rest through that hip. Good. Now you're going to swing the hip up, leg up. So you can come into sitting like you did on the other side, facing that way if you can. That's it. Sitting upright. And then just lift this leg up. It's quite tough. You can hold onto the leg if you need to, but what that does is to start working through the quadricep that you've just stretched. Excellent. Have a breather. Come into kneeling now. Back into kneeling, back into that sit back and curl position that we did at the start and in the middle of the session. So come into kneeling, facing in that direction. Good. Brilliant. So now we can do an assessment. So come up into high kneeling, that's it. And your pelvic floor, the abdominals are going to be engaged, so core engaged. Hands to the pelvis. Now we're going to do a sit back and curl, 3 of them, just assess and feel if hopefully it has helped you to feel more mobile in your hips. So Tom's going to sit back halfway or further if you feel that you've got that mobility. And curl the pubic bone up towards you. Brilliant. And sit back. And I can already see with him, he's moving in a faster way, and it's in a controlled way as well, which is brilliant. I can see he's got better mobility going on there. Well done, Tom. Great. And have a rest. Well done. Thank you for joining us. That is the end of your week 1 advanced class.